Defining stress is complex, since definitions of stress depend on the viewpoint and discipline of each individual researcher or clinician. Nurses and other health professionals consider stress in the context of emotional, behavioral, and psychological factors of our patients. Stress involves nearly every organ system and tissue in the human body. Stress puts the body in a state of increased alert, and long-term stress can cause inflammation, weaken the immune system, and increase the risk of digestive issues, heart disease, respiratory conditions, and stroke. Many struggle to cope when it comes to stress management and are bearing the burden alone. Therefore, as nurses, we need to be familiar with the various dimensions of and responses to stress to effectively assess and treat clients and families suffering from its impact. Stress is the physiological, emotional, or physical response and adaptation to real or perceived changes and challenges. It is a condition in which the body responds to changes affecting its normally balanced state of equilibrium. Stress can be caused by physical, emotional, environmental, or mental challenges. It can be either positive or negative, depending on how the individual perceives the stress. A stress reaction occurs when perceived demands exceed the individual's existing resources to meet those demands. Stressors are inherently neutral, so it's in an individual's perceptions of and responses that determine whether a particular stressor is positive or pleasant, eustress, or negative or unhealthy, distress. Positive stress, also called eustress, is often associated with accomplishment or achievement and generally produces feelings of well-being, inspiration, and motivation. In contrast, unhealthy or chronically prolonged stress levels of distress, coupled with poor practices, can lead to physical and emotional fatigue and ill health. Stress can be situational, like adjusting to a chronic disease or a stressful job change. Stress can be developmental, which means it varies with life age. Adult stressors can include losing parents, having a baby, and getting married. Stress can be caused by socio-cultural factors, including substance abuse, lack of education, and prolonged poverty. Stress not only impairs and weakens the immune system, but also is a causal factor in numerous health conditions. Physiological and psychological responses to stress. The optimal stress response depends on intact, well-functioning body systems. Usually, everyday stressors are effectively managed through regulation processes to minimize stress's impact on the individual and to help us maintain health. When a person experiences a potential or actual stressor, the situation is appraised and the limbic system activates an anticipatory response. If the stressor is perceived as minor, physiological, psychological, and behavioral processes compensate for it and homeostasis is maintained. In contrast, if the stressor is perceived as a more serious threat, the body mounts a response initiated by the nervous and endocrine systems. The hypothalamus, the pituitary gland, the sympathetic nervous system, and the adrenal glands all participate in this stress response. When a situation is deemed to be stressful, the hypothalamus secretes corticotropin-releasing factor, which activates this SNS to release norepinephrine, epinephrine, and dopamine. This reaction, which is also known as the fight or flight response, causes an increase in heart rate, blood pressure, and cardiac output, dilation of the bronchial airways, pupil dilation, and an increase in blood glucose levels. You are stressed out. The CRF also signals the anterior and posterior pituitary glands to release adrenocorticotropic hormone, ACTH, from the adrenal cortex, which is part of the autonomic nervous system. The autonomic nervous system is the part of the peripheral nervous system that helps maintain homeostasis in the body and generally works without conscious control. ACTH stimulates the adrenal glands to release cortisol, which triggers behavioral responses such as mental alertness, focus, and the reduction of pain receptors. Cortisol also has immunosuppressive and anti-inflammatory effects. Once the stressful situation is passed, the brain signals the body systems to recover and reestablish balance in all systems by replacing lost nutrients and eliminating waste products that accumulated during the stress response process. General adaptation syndrome. Also known as stress syndrome, it's a theory of adaptation that describes the stress reaction in 3 stages. The alarm stage, body functions are heightened and to respond to stressors, also called flight or flight response. Hormones, epinephrine, norepinephrine, cortisone, are released, which cause elevated blood pressure and heart rate, heightened mental alertness, increased secretion of epinephrine and norepinephrine, and increased blood flow to muscles. In the resistance stage, body functions normalize while responding to the stressor. The body attempts to cope with the stressor and return to homeostasis. Stabilization of blood pressure, heart rate, and hormones will occur. The exhaustion stage, body functions are no longer able to maintain a response to the stressor, and the client cannot adapt. The end of this stage results in recovery or death. Adherence refers to the commitment and ability of the client and family to follow a given treatment regime. Commitment to the regime increases adherence. Complicated regimes interfere with adherence. Involvement of the client and significant support people in the planning stage increases adherence. Adverse effects of medications diminish adherence. Negative coping mechanisms like denial can cause non-adherence. Positive coping mechanisms can cause adherence. Available resources also increase adherence. The transactional theory of stress and coping describes stress as a dynamic process that includes a transaction between a person and his or her environment. It suggests that an individual goes through 2 stages of appraisal, primary and secondary, before responding to stress. How an individual appraises a stressor determines their response. If determined to be a threat, the individual assesses whether they can cope with the situation by examining both the demands and the resources available to address the threat. There are 2 broad categories of stressors, physiological and psychological. Both categories may be either acute or chronic. Physiological stressors are generally associated with injury or illness, such as exposure to extreme temperatures, trauma, injury, illness, or pain. The body's reaction to acute physiological stress is immediate and necessary for survival. Chronic physiological stress can result in debilitating conditions. Psychological stressors are more common and generate a state of emotional unease. A psychological stressor is an event, situation, comment, condition, or interaction that an individual interprets as negative or threatening. Common psychosocial stressors include work or academic pressures, financial difficulties, changes in marital status, or being a victim of a natural catastrophe. Like chronic physiological stress, chronic psychological stress can be debilitating and incapacitating. Types of stress. When individuals experience a real or perceived threat or stressor, the body releases a series of biological chemicals. Stress is generally categorized by 3 types: acute stress, episodic acute stress, and chronic stress. Each type of stress is characterized by different factors and physiological and emotional responses. Acute stress is the most common and frequently experienced type of stress. It is usually brief and can be either positive or negative. Acute stress causes an immediate reaction and biological response to a perceived stressor and triggers the flight or fight response. Examples or causes of acute stress include being involved in a motor vehicle accident, experiencing the loss of a loved one, or being a victim of a crime. Manifestations of acute stress include irritability, chest tightness, headache, gastrointestinal disturbance, sweaty palms, and shortness of breath. Most episodes of acute stress do not have lingering health effects. However, if an individual experiences severe or prolonged stress levels, this condition could lead to mental health issues such as post-traumatic stress disorder or acute stress disorder. Episodic acute stress occurs when someone experiences frequent bouts of acute stress. This type of stress is often associated with individuals taking on more responsibility than they can reasonably handle and frequently feeling disorganized and rushed. In addition to being short-tempered, irritable, and anxious, individuals who suffer from episodic acute stress may experience tension headaches, hypertension, and migraines. Clients with a pattern of episodic acute stress tend to have a pessimistic outlook and negative worldview. Over time, episodic acute stress can negatively impact relationships, work, and overall health. Chronic stress is a debilitating condition that occurs when stress levels are heightened, constant, and prolonged. Individuals experiencing chronic stress often believe they have little or no control over their situation or circumstances. Chronic stress produces continuous activation of the nervous system and can cause or exacerbate many serious health problems, including anxiety, depression, cardiovascular disease, cancer, and suicide. This kind of unrelenting level of stress often stems from serious life problems such as poverty, racism, illness, disease, or living in a dysfunctional family system. Factors contributing to stress. Individuals in all populations across the lifespan are susceptible to stress-related conditions. However, everyone reacts differently to stressful situations. What might be considered stressful for one person may not be stressful for another, and nearly any event can be a potential trigger for a stress response. Some common major life events that can trigger stress include work-related issues, financial pressures, bereavement, family problems, illness, fear of criminal victimization, excessive noise and overcrowding, and fear of the unknown. Stress-related disorders may occur as a result of prolonged and heightened levels of stress and anxiety. The onset and severity of these disorders are affected by the type, frequency, and intensity of the stressor, the person's perception of the stressor, access to support system, and the individual's ability to effectively cope with the stressor. Some common stress-related disorders include acute stress disorder, post-traumatic stress disorder, and irritable bowel syndrome. Acute stress disorder results from an overwhelming event that causes an intense and dysfunctional reaction. If the symptoms of ASD last beyond a month, post-traumatic stress disorder will be diagnosed. Individuals diagnosed with acute stress disorder have often been exposed to a frightening or traumatic event such as the death of a loved one, a threat of serious injury to themselves or others, or exposure to war or other acts of violence. Clients with acute stress disorder may experience feelings of numbness, disconnectedness, depersonalization, and other dissociative symptoms. Other symptoms include disrupted sleep, irritability, difficulty concentrating, and becoming easily startled. Many clients mentally re-experience the traumatic event and avoid people, places, and things that remind them of the traumatic event. Some individuals experience prolonged and heightened stress following a traumatic event, such as an accident, sexual abuse, or a naturally occurring disaster, and are ultimately diagnosed with post-traumatic stress disorder, PTSD. PTSD is among the most common mental health disorders in the United States. It's associated with a chronic course and debilitating symptoms. Although most individuals will experience some type of trauma event in their lifetimes, most of these trauma-exposed individuals will not develop PTSD. Manifestations of PTSD include recurring and intrusive memories or flashbacks of the trauma, nightmares, sweating, increased heart rate, and an exaggerated startle response to certain noises or experiences that remind the person of the trauma. Irritable bowel syndrome is a common chronic gastrointestinal condition manifested by symptoms of abdominal discomfort, cramping, bloating, diarrhea, and/or constipation. IBS is not considered a disease, but rather a functional syndrome with no known cause. IBS significantly impacts an individual's quality of life and exacts a substantial toll on overall health. Because it is a multifactorial disorder, approaches to its treatments are similarly diverse. Patient education by nurses and other members of the healthcare team is an essential component of successful treatment and management of IBS. Stress is a common trigger for IBS, so treatment planning should include reducing stress with techniques and activities. A crisis is a threatening situation triggered by a precipitating event to which an individual experiences a strong behavioral, emotional, or psychiatric response. This kind of emotionally significant life event or major change in an individual's life pushes the person well beyond their ability to effectively cope. Crises may include an unexpected or unanticipated event with insufficient time to prepare or respond, a highly threatening incident or disaster, or a radical change in one's life with a corresponding lack of ability to respond effectively. Examples include traumatic injury, natural disasters, and loss of financial security. Levels of crisis severity range from level 1, which is the least severe, to level 4, which is the highest level. Whenever a risk of harm to self, suicide, or to others, homicide is present, providers must swing into action to prevent and address it immediately. Nurses must assess their clients for risk factors and warning signs related to these potential acts of violence and apply interventions to mitigate and treat the risk to self and others. Individuals who commit violence against others may have risk factors such as a history of substance misuse and addiction, a history of violence towards animals and people, and a history of psychiatric illness. Other risk factors are associated with acts of violence directed towards oneself, including a history of depression and suicidal behavior, a family history of abuse and neglect, and ongoing relationship problems. Because of the intensity of the crisis, the individual may also be out of touch with reality and severely agitated. If left untreated, this condition may result in a medical or mental health emergency. During a crisis, the person may threaten suicide, display highly erratic or unusual behavior, misuse alcohol and other substances, and refuse intervention. Evidence that a person is experiencing a mental health emergency include acting on a suicidal threat, displaying hostile and belligerent behaviors, throwing or breaking items, or threatening harm. Types of crises. Crises are experienced by people of all ages, backgrounds, cultures, and environments. Sometimes a crisis may seem obvious, such as experiencing the death of a loved one or dealing with a natural disaster. At other times, a crisis may be less apparent, such as an internal fear of being exposed to an infectious disease. In either case, the crisis often creates a sense of imbalance and confusion in a situation where usual coping skills may be inadequate. Although crises can arise from many different sources, they are often categorized as stemming from situational, developmental, maturational, adventurous, socioeconomic, and cultural stressors. Situational stressors are caused by personal, family, or work-related issues. Examples of personal stressors include being diagnosed and living with a chronic illness, financial strain, and being a victim of a motor vehicle accident. Family stressors may include the death of a loved one, a change in marital status, being unable to conceive, or experiencing an unwanted pregnancy. Work-related issues may include downsizing, sheltering in place, or changing work roles and responsibilities. Nurses and other healthcare workers need to be particularly alert to the potential for work-related stress in themselves, as this stressor may lead to burnout, compassion fatigue, and moral distress. Moral distress occurs when a nurse is placed in a difficult situation where the actions taken are different from what the nurse feels is ethically correct. These situations complicate the nurse's ability to balance moral, emotional, and professional duties to their clients as well as themselves. Both physical and psychological manifestations can occur when a nurse is experiencing moral distress. These may include feelings of frustration, guilt, insomnia, fatigue, and result in withdrawal and depersonalization of clients. Although moral distress can occur at any time during nursing care of clients, it is often heightened during a time of crisis, disaster, or tragedy. Nurses who suspect they may be experiencing moral distress should ask for professional assistance in identifying the underlying issues and communicate with leadership to find a solution to support nurses in the delivery of quality care to the client. Developmental or maturational stressors vary throughout the lifespan and occur as individuals move through the stages of life. Children and pre-adolescents often identify stressors related to physical appearance, family, friends, and school. Adolescents may experience stress related to friendships, belongingness, identity formation, and leaving the family home. Adult stressors may include marriage, beginning a family, launching a career, and accepting physical aging. Seniors and older adults may be stressed by health problems and changes in mobility and cognition. Adventitious stressors are also called disaster events because they are generally rare and unexpected. Such stressors can result from natural disasters such as floods, earthquakes, and war, or from interpersonal disasters such as physical or sexual assault. Acts of terrorism may also be considered adventitious events since previous methods of coping may not be sufficient for dealing with the magnitude of the stress. Socioeconomic stressors. The adverse effects of low socioeconomic status on mental and physical health are well documented. Factors such as poverty, lower socioeconomic status, and homelessness contribute to nearly every measure of mental health, including measures of self-reporting distress and diagnoses of clinical disorders. While the relationship between low SES and mental health disparities has been consistently demonstrated, the potential consequences of socioeconomic stressors are not necessarily fixed or universal. Cultural stressors. Individuals may experience cultural stressors when they live within a society in which they do not culturally fit or when they receive care that ignores their cultural beliefs. Cultural factors include beliefs and values that influence how an individual perceives and responds to stress, since all individuals appraise stressors within the context of their culture. Thus, a stressor that is perceived as highly stressful in one culture may be viewed as a minor stressor within another culture. Coping strategies vary from culture to culture. During a crisis, the nurse establishes and maintains a therapeutic nurse-client relationship using effective communication skills and by providing a safe, calming relationship using effective communication skills and by providing a safe, calming environment. Clients in crisis often require frequent or constant observation and, in some cases, pharmacologic or medical intervention to achieve an optimal level of functioning and health. Crisis intervention is not process-oriented, but rather action and situation-focused. The goal is to help the client identify precipitating events leading up to the crisis, utilize skills, resources, and available support systems to effectively deal with the crises, and formulate a plan of care for current and future critical events. Understand that there are crisis models that can be used during a crisis situation to help provide optimal care for clients. Defense mechanisms. The defense mechanism is a mental operation that occurs outside of conscious awareness and that functions to protect an individual's self-esteem, keep the person from experiencing excessive anxiety, and in extreme cases, protect the integration of the self. Defense mechanisms are psychological strategies that help individuals separate from and put distance between themselves and unpleasant events, feelings, or thoughts. A normal and natural part of psychological development, these mechanisms are useful in protecting the human psyche from anxiety and fear. In some cases, defense mechanisms can be misused or distorted, leading to cognitive distortions or thinking errors. Thinking errors are faulty patterns of thinking and unhealthy ways of coping that become self-defeating and often occur unconsciously. Types of defense mechanisms. Denial is a refusal to acknowledge or accept reality to avoid the emotional impact. I didn't do that. Rationalization is a justification or explanation of undesirable behaviors to avoid emotional discomfort or to save face. I did that because projection is an attribute is to attribute negative or uncomfortable thoughts, feelings, or motives onto someone else. That wasn't me, that was you. Repression conceals unpleasant or painful thoughts, memories, or beliefs in hopes of forgetting about them entirely. I'm not even going to worry about that. Regression is movement back to a more comfortable developmental time in life. And compartmentalization is categorizing life experiences into segments to avoid facing the anxieties while in that mindset. I'm just going to put that in a box and think about it later. Stress in the nursing profession is associated with caring for others. Even though stress in nursing is one of the most significant issues, it is often underrated. Stress emerges in several aspects of a nurse's work and personal life due to time constraints, work pace, long work hours, and performance expectations. Stress can affect the nurse's health and well-being and can potentially impact client outcomes. To help nurses combat stress, the American Nurses Association designed a program called Healthy Nurse, Healthy Nation to transform the health of the nation by improving the health of all of the nation's registered nurses. Dealing with stressful situations. Care and compassion are fundamental to nursing practice. However, self-care is rarely a priority in today's world. Nurses need to be mindful of their work, strive to lead healthy lives, and be an example for others. Therefore, if your methods of dealing with stress are not working, it's time to find healthier ones. Managing stress is about taking charge of your thoughts, emotions, schedule, and environment. The goal is a balanced life, time for work, relationships, relaxation, and fun, plus the ability to handle pressure and meet the challenges head first. Everyone has a unique stress response, and strategies or techniques that an individual will use varies. Each technique requires change. An individual can change the situation or change their reaction. When deciding on an option, the 4 A's can be helpful: adapt, alter, or avoid, accept. One should practice and identify what helps them feel calm and in control. Avoid, say no, take control of your surroundings by avoiding people who cause you stress and avoid getting pulled into the hot topic conversations. Alter, be more assertive by expressing yourself and discussing your feelings, maintaining time efficiently, and practicing compromise. Adapt, reframe your thinking, know worst-case scenarios, adjust your standards, look at the big picture, and focus on the positive. And accept, is your worry something you can solve or fix? If not, accept the uncertainty, look for the upside in everything, and forgive quickly. The role of the nurse for clients experiencing stress. The role of the nurse includes conducting a comprehensive assessment of the client's condition. There are evidence-based tools that exist to evaluate patients in this way. For example, the Psychological General Well-Being Index measures a client's level of subjective psychological well-being and self-representations of affective or emotional states, which reflects the client's sense of subjective well-being or distress. The full scale provides subscales to assess anxiety, depression, positive well-being, self-control, general health, and vitality. Other valid measures include the Beck Depression Inventory and the Ways of Coping Questionnaire. Before conducting a coping assessment, the nurse should first establish rapport and build a trusting nurse-client relationship to provide a safe, confidential environment conducive to sharing personal and sensitive information. Nurses use several therapeutic communication techniques to build trusting relationships, including active listening, asking open-ended questions, seeking clarification, and offering observations. Nurses in all areas of nursing practice need to recognize the physiological and psychological signs and symptoms of stress in their clients, implement and evaluate effective interventions, and provide ongoing client education on this topic. Signs and symptoms of stress and associated health alterations can manifest in a variety of ways and with varying levels of severity. The nursing process is very helpful in assessing, analyzing, planning, implementing, and evaluating care for patients in regards to their coping mechanisms. Questions to ask during the assessment phase include current stress, perception of stressors, and ability to cope. What are their support systems? Are they able to adhere to healthy behaviors or a treatment regime? What are their sleep patterns? Do they have any altered elimination patterns, change in appetite, or weight loss or gain? How do the patient's appearance and eye contact, verbal, motor, and cognitive status appear during the assessment? What are their vital signs? Are they irritable, anxious, or have expressed tension? Nursing care that we can stress is encourage health promotion strategies like regular exercise, optimal nutrition, adequate sleep and rest, assist with time management and determining priority tasks, encouraging appropriate relaxation techniques like breathing exercises, massage, imagery, yoga, or meditation. We can listen attentively and take the time to understand the client's perspective. We can control the environment to reduce the number of external stressors, including noise and breaks in the continuity of care. We can identify available support systems. We can educate the client on available training to manage stress, like journal writing, assertiveness training, stress management in the workplace, or mindfulness-based stress reduction. We want to be empathetic in communication and encourage the client to verbalize feelings. We want them to identify theirs and their family's strengths and abilities. We have to encourage autonomy with decision making. We have to discuss the family and client's abilities to deal with the current situation. We have to encourage the client to describe coping skills used effectively in the past. We have to identify available community resources and refer the client for counseling if needed. For evaluation, when having a client adhere to a coping regime, we want to put our instructions in writing, allow the client to give input into the treatment regime. We want to simplify them as much as possible and follow up to address any questions or problems. Coping refers to the strategies that an individual adopts to deal with a stressor which is highly influenced by psychological, sociological, and cultural factors. Stressors and coping mechanisms vary across the lifespan and depend on an individual's appraisal of the stressor, the amount of and type of social support available to manage the stressor, the importance placed on the stressor, the severity of the stressor, and the ability to cope effectively in a healthy manner. A positive outcome is not necessarily associated with adequately managed stress. Meaning just because a person can get through the day doesn't mean they're managing their stress appropriately. Clients might adopt either a problem-focused or an emotion-focused coping style. A problem-focused approach involves dealing with the situation itself by trying to change it into something more palatable. In contrast, an emotion-focused approach requires altering our association with the situation to decrease the stress that it may be causing. This can include either avoiding the situation or reframing its meaning. While this approach does not change the nature of the situation itself, it does change how the situation affects the individual. Coping strategies are classified as adaptive if they help an individual manage stress in the short and long term, such as changing an unhealthy habit. Maladaptive coping behaviors reduce stress in the short term, but often exacerbate the problem in the longer term, such as misusing drugs to cope. Coping describes how an individual deals with problems and issues. It is the behavioral and cognitive efforts of an individual to manage stress. Factors influencing an individual's ability to cope include the number, duration, and intensity of stressors, the individual's past experiences, the current support system, and available resources. Coping strategies are unique to an individual and can vary greatly with each stressor. Ego defense mechanisms assist a person during a stressful situation or crisis by regulating emotional distress. Health promotion is the art and science of helping individuals change their lifestyle to achieve optimal health. We've discussed this before. By practicing health promotion, people can be proactive and take control of their personal health rather than having to respond to illness and disease. Nurses have the important role of educating clients and families about the benefits of health-promoting behaviors and activities. Health promotion activities include interventions that mitigate or reduce stress-producing situations and increase resistance to stress. Several strategies and techniques are available to help individuals cope effectively with stressors that life brings. A healthy diet can help offset the impact of stress by strengthening the immune system, lowering blood pressure, and supporting overall good health. One of the best stress-reducing strategies is to exercise and increase physical activity. Cardiovascular exercise boosts oxygen circulation and spurs the body to produce feel-good chemicals called endorphins. Managing time well and staying organized can also be a stress-reducing strategy. Time management techniques help reduce stress by identifying tasks and activities that require immediate attention versus tasks that can wait. Resilience is the ability to bounce back from life's various challenges and to adapt well in the face of adversity, trauma, and stress. It can be fostered by practicing mindfulness activities. Mindfulness is the state of paying attention and being fully present and alert to your surroundings and environment. It means focusing attention in a purposeful way on the present moment, becoming aware of what is happening in the here and now, and being cognizant of your internal and external worlds without judgment. Rest and relaxation. Establishing a regular routine for getting adequate rest and sleep is essential for ensuring overall good health and reducing stress. Adequate sleep is necessary for the body to repair and restore itself and to release melatonin, an essential hormone for regulating sleep-wake cycles. Sleep quality can be enhanced by going to bed and rising the same time each day, avoiding nicotine, caffeine, and alcohol before bedtime, unplugging from media devices, and keeping a comfortable, cool, and dark sleeping space. Guided imagery is a helpful technique to alleviate stress by using a combination of relaxation, visualization, and imagination. After assuming a relaxed and comfortable position, the individual focuses on a pleasurable image, experience, or event while practicing progressive relaxation. Progressive relaxation includes tensing and releasing each muscle group in the body, beginning with the head and moving to the toes. Complementary and alternative therapies refer to treatments such as aromatherapy, herbal medicine, acupuncture, massage, biofeedback, and meditation. An increasing number of patients are using complementary and integrative health products and therapies. In turn, nurses need to have a working knowledge of these therapies since they offer clients new avenues that may improve their overall health. Keeping a personal journal of thoughts, feelings, and emotions can provide a meaningful and productive outlet for stress. Expressing gratitude is another way to reduce anxiety. When feeling stressed, anxious, or overwhelmed, an individual can reflect on a person, experience, event, or thing for which they are grateful and record the reflection in a journal. Conveying gratitude may be one of the most effective strategies for achieving and maintaining a contented life. The slide gives you two activities, a mindfulness practice and a mindfulness activity, different ways that you can do that. In summary, these are the important parts from this PowerPoint. Stress is the mental, emotional, or physical response and adaptation to real or perceived changes or challenges. All individuals experience stress as a normal part of daily life, and responding to stress is a necessary physiological process for regulation and homeostasis. You need to know and understand what stress is and how it is defined. When a situation is determined to be stressful, the nervous and endocrine systems respond by initiating the flight or fight response. So you need to understand how the fight or flight response comes about when people think something is stressful. When an individual is disrupted by stress, the body works to maintain equilibrium by engaging the general adaptive system, which consists of three-stage response: alarm, resistance, and exhaustion. The general adaptive syndrome may be triggered by physical or psychological stressors or events. The transactional theory of stress and coping describes stress as a dynamic process and a transaction between a person and their environment. How an individual appraises a stressor determines how that person will respond to the stressor. Stress is generally categorized into three types: acute stress, episodic acute stress, and chronic stress. You need to know that stress-related disorders may occur as a result of prolonged and heightened levels of stress and anxiety, including acute stress disorder, post-traumatic stress disorder, and irritable bowel syndrome. You need to know that a crisis is an emotionally significant life event or major change in an individual's life that pushes the person well beyond their ability to effectively cope. Crisis severity ranges from level 1, the least severe, to level 4, the highest level. Crises arise from various sources that can generally be categorized as situational, developmental or maturational, adventitious, socioeconomic, and cultural stressors. The goal of crisis intervention is to help the client identify events leading up to the crises, utilize skills, resources, and available support systems to effectively deal with the crisis, and formulate a plan of care for current and future critical events. Defense mechanisms are psychological strategies and mental operations that occur outside of conscious awareness and that protect an individual's self-esteem, keep the person from experiencing excessive anxiety, and in extreme cases protect the integration of the self. A normal and natural part of psychological development, they are useful in protecting the human psyche from anxiety and fear. The role of the nurse includes conducting a comprehensive assessment of the client's condition. Several evidence-based assessment tools can be used to evaluate the physiological, psychological, emotional, and behavioral signs and symptoms of the stress. Nurses in all areas of nursing practice need to recognize physiological and psychological signs and symptoms of stress in their clients, implement and evaluate effective interventions, and provide ongoing client education. The nursing process provides a 5-step systematic approach to health to assess the client's condition and implement a client-centered, individualized, holistic plan of care. Coping refers to the strategies that an individual adopts to deal with a stressor, which are highly influenced by psychological, sociological, and cultural factors. Coping strategies are classified as adaptive if they help an individual manage stress in the short and long terms, such as changing an unhealthy habit. Maladaptive coping behaviors reduce stress in the short term but often exacerbate the problem in the longer term. Health promotion is the art and science of helping individuals change their lifestyle to achieve optimal health. It enables people to increase control over their personal health by addressing and preventing the root causes of ill health, not just focusing on treatment and cure. Strategies and techniques to help individuals cope effectively with the stressors that life brings include maintaining a healthy diet and nutrition, learning time management, building personal resilience, rest and relaxation, and practicing complementary and alternative therapies, and journaling.